Hello, I'm Dr. Danny Meyersfeld, one of the founders of a company called DnaLife. I'm here to speak to you today about personalized medicine and nutritional genetics, as well as introducing my company DnaLife, who we are, what we stand for, and what differentiates us from other companies in a highly competitive environment. At DnaLife, we place a large emphasis on the education and training of healthcare practitioners, ensuring that they are comfortable and confident to incorporate genetic tests into their practice and understand the benefit of these genetic tests to their patients. Through the coming lectures, we'll be introducing you to our tests and make sure that you understand the terminology, the language of genetics, as well as the fundamental principles that govern each of the tests we offer, and are comfortable with understanding how these can benefit your patient's health and enhance your scope of practice. So what is personalized medicine, and why is it of interest to a healthcare practitioner? Personalized medicine is an emerging science of medicine that uses an individual's genetic profile to guide the prevention, diagnosis, and treatment of disease. It is an acknowledgement of the individuality of every patient that walks into a medical practice, and the realization that a uniform treatment approach is no longer sufficient to ensure the optimal health of the patient. Our genes determine who we are, from the obvious characteristics we see when we look at each other to the less obvious differences, such as our risks for different disease and our ability to respond to certain medications. Personalized medicine is providing doctors with the tools to highlight these differences and to use them as a basis on which to make precision treatment decisions. We firmly believe that the future of health and wellness will lie in the personalization of diet, lifestyle, and supplement recommendations according to individual requirements. Healthcare will become predictive, preventive, personalized, and practitioner-driven. Based on unique genetic differences within a population of patients, the risk for disease, nutrition strategies for reducing disease risk, general dietary guidelines for healthy nutrient intake will all be tailored to the individual needs of the patient. Loosely defined, there are three branches of personalized medicine: nutritional genomics or nutrigenomics, pharmacogenomics, and cancer diagnostics. The bulk of your training in the coming lectures will center around nutrigenomics, the association between our genes and the nutritional environment in which we place ourselves. Nutrigenomics is the study of the effects of foods and food constituents on gene expression, and seeks to provide a molecular understanding of how common chemicals in the diet affect health by altering the expression of genes. We will also be introducing the concept of pharmacogenomics, which looks at the relationship between the genes we carry and prescription medications that we often take. Differences in the mode of action of our drug metabolizing enzymes can lead to drugs being either completely ineffective or possibly toxic. Pharmacogenomics is the science of personalized drug prescriptions to ensure that the right patient is given the right drug at the correct dose. The third pillar is cancer diagnostics. Currently a little outside the scope of these lectures and not the main focus of our work within DnaLife, it is nonetheless a critical aspect of personalized medicine that allows for the early identification of cancer markers and the identification of the most effective intervention strategies to combat that cancer. The vast and rapid growth of all of these omics technologies has led to a rapid and comprehensive understanding of how bioactive compounds affect human health. It's given us a better understanding of the health impact of specific dietary factors and nutrients. It's created the possibility of individual recommendations for personalized nutrition, and it's created an urgent need for suitably trained and educated healthcare practitioners. It was in this healthcare environment that two well-established and recognized companies, Nordic Laboratories and DNalysis Biotechnology, joined forces a few years ago to create an entity called DnaLife. To give some background on the individual companies, Nordic Labs was founded almost 20 years ago with the aim to support and promote individualized healthcare through an unwavering commitment to scientific integrity, innovation, and doing what is best for the patient. In this time, they have developed a worldwide reputation for selecting only the most innovative and reliable laboratory assessments from a wide range of suppliers, based on the accuracy and value of each test. As a result, practitioners have access to the highest quality tests available anywhere in the world from a single supplier. DnaLife Biotechnology was founded almost 10 years ago with the aim to bring state-of-the-art molecular technologies to the health and wellness markets, with the primary aim being to leverage scientific advances in human genomics research to benefit the health-conscious consumer and to provide access to these advances in a manner that is easily utilized by the healthcare practitioner. The primary focus is on the relationship between genes, nutrition and lifestyle in determining health and wellness. These two like-minded entities came together to create DnaLife, a company dedicated to the training and education of healthcare practitioners. We aim to provide healthcare practitioners with the training required to accurately and usefully interpret genetic results for their patients and transition these results into realistic health solutions. DnaLife provides a full range of genetic tests and supports their use with comprehensive practitioner training in genetics and nutrigenomics. We furthermore provide access to an extensive portfolio of functional tests, which can often be paired with genetics to gain a more comprehensive picture of human health. DnaLife provides the end-to-end solution of education, training and implementation of utilizing genetic and functional tests in the healthcare environment. Through our online portal, VMS, the healthcare practitioner can manage test orders, shipping and logistics solutions, as well as reporting of results. The purpose of this collaborative effort is to push clinical methods forward by empowering practitioners to take advantage of this exciting area of science and use it to improve patient health. So why use DnaLife, and how do we differentiate ourselves from other companies in a crowded market? It is becoming increasingly difficult to distinguish one test provider from another as laboratories around the world jump onto the personalized medicine bandwagon. Just some of the things that differentiate us and things one should always consider when looking to incorporate personalized medicine into practice and one is in the process of choosing a service provider are as follows. Healthcare practitioners are required to undergo intensive training before working with our tests. We provide constant technical support for healthcare practitioners, and regular continued education is also provided once they are working with the tests. Our reports are easy to understand and are continually updated as evidence demands it. We are completely transparent with our gene and SNP selections and are able to justify the inclusion of every SNP in our tests. Our gene selection process is highly stringent and limits the tests to a small number of only the most relevant, clinically valuable information. Every SNP that is included in a test has evidence of an appropriate intervention that can modify the effect of the SNP. As a healthcare practitioner looking to incorporate genetic testing into your practice, this is something which we would like to emphasize. More is not necessarily better when it comes to the number of genes in the test. We've worked incredibly hard at DnaLife to make things as simple and yet comprehensive for the healthcare practitioner as possible. So we're looking at the most important, the most well-researched, the most well-validated genes only, and ignoring the other genes where there's potential for confusion or contradiction. Having spent the last 20 years refining our logistics management systems, and we can ship test kits from and to anywhere in the world, and we provide highly competitive pricing, which is all important in a crowded marketplace. We are continually striving to innovate and have recently introduced the concept of test pairing, offering healthcare practitioners a powerful platform on which to build individualized treatment strategies that incorporate both nutrigenomics testing and appropriate functional tests. This constant quest for innovation further differentiates us from other players in the market. So now that we understand a little bit more about who we are and what we do, let's take a closer look at the various products that are offered within the DnaLife portfolio. We're going to limit this discussion to only the genetic-based tests, our nutrigenomics and pharmacogenomics product offering, but remember that there is an extensive portfolio of over 100 functional tests that are also available through DnaLife. So the four main nutrigenomics products are DNA Health, DNA Diet, DNA Estrogen and DNA Sport, and this is complemented by our pharmacogenomics offering known as MyGeneRx. To go into a little bit of detail on what these tests are, DNA Health is designed to optimize well-being and health by personalizing lifestyle and diet choices, and where necessary using supplements tailored to offset any particular nutritional deficit or genetic variation. The DNA Health approach assists the healthcare practitioner in establishing optimal nutrition necessary for good health, longevity, and disease risk mitigation. The health looks at genes across multiple biological areas, all of which are critical to ensure human health. These areas are lipid metabolism, methylation, detoxification, inflammation, oxidative stress, insulin sensitivity, bone health, and food responsiveness, such as lactose and celiac risk, salt or caffeine sensitivities. Just to show a small extract from a sample report, the reports are laid out in a user-friendly manner for the practitioners, where we give a description of the metabolic area which is being analysed. We show a summary table with the genes comprising that metabolic area and an impact factor that we've assigned to those genes, so one can easily see at a glance whether there are any high impact markers that need closer attention. And then we give individual gene result details, which is gene specific content and recommendations for the practitioner on how to action and intervene on any genetic variations that have been identified. Our next test is DNA diet. Genetics determines an individual's susceptibility to obesity when exposed to an unfavorable environment, as well as the way he or she responds to diet and exercise. We all know intuitively that not everybody responds the same way to a weight loss strategy. Some of us respond very quickly, others respond slower. The DNA diet test is designed to give the healthcare practitioner insight into the diet that is most likely to benefit their patient to ensure optimal weight loss. So we're looking at the genetics of weight management, comprising genes that are relating to weight loss resistance, diet and exercise responsiveness, optimal macronutrient distribution for healthy weight loss, and ultimately determining the best diet possible for each individual. Again, an extract from a sample report where we see the results summary table. Each gene and genetic variant that is identified has been assigned an impact factor by our experts, so you can easily see whether there is a high impact genetic variant that is requiring closer attention. And then in addition to giving our recommendation for what the best diet would be, choosing between a low fat, a low carb, or a Mediterranean style diet, we also give the genetics of various lifestyle factors to allow further personalization of these diets. So we're giving you graphic representation of the person's obesity risk, their responsiveness to saturated fats, their responsiveness to carbohydrates, and their requirement for exercise in the weight loss program. And these can all be used to further personalize the weight loss intervention strategies for the patient. DNA estrogen is a test that looks at genetic variants associated with estrogen metabolism. Close to 80% of breast cancer is sporadic, and research has shown that an increased lifetime exposure to estrogen is a strong risk factor in the development of breast cancer. DNA estrogen tests for gene variants that have been shown to have an impact on how estrogen is metabolized, and therefore may help lessen an individual's risk for developing breast cancer. Improving estrogen metabolism is of benefit to women who suffer from estrogen-dominant conditions. DNA estrogen reports on the following areas: Phase 1 detoxification, Phase 2 detoxification, oxidative stress, personal risk factors associated with hormone replacement therapy, oral contraceptives, bioidentical supplementation, and in vitro fertilization, and intervention strategies for those patients who are shown to be at risk. Again, extract from a sample report, we see the gene that is being analyzed, in this case CYP1A1. We're giving an explanation of what that gene's role is in the estrogen metabolism pathway. We're showing your genetic result and the significance of that result through the and specific interventions and content that are relevant to that particular genetic variation. Our final nutrigenomics test is called DNA Sport, which results provide insight into various biological areas that impact training responsiveness and sporting performance, optimal exercise selection, and injury and recovery strategies. This test is suitable for elite performance athletes as well as recreational athletes looking to maximize their fitness potential and reach peak levels of conditioning. DNA Sport reports on multiple metabolic areas associated with training and injury and recovery. Some of these listed are our circulation and blood pressure, strength, cardiopulmonary capacity, muscle fiber specialization and hypertrophy, cardiac input, muscle metabolism, adaptability to training regimes, structural integrity of soft tissues, and inflammation and free radical stress processes. What we do in the sample report for DNA Sport is provide injury and recovery risk as low, medium, or high risk, as well as giving the appropriate strategies for bringing these risks down. We're showing the athletic potential in terms of split between power and endurance capacity, as well as providing sample training programs that would be most suited to the individual based on strength and endurance, injury and recovery strategies. This brings us to the first test in our pharmacogenomics portfolio, a test called DnaLife, which has recently been added to the testing categories within DnaLife. Pharmacogenomics is an important area of science, as the vast majority of individuals will carry at least some genetic variation which will preclude the drugs they're taking from being effective. Upwards of 70% of the population will carry such genetic variations, and so knowledge of these genes will allow the healthcare practitioner to prescribe the right drug for the individual at the correct dose to ensure that there are no possible toxic side effects. DnaLife is a comprehensive pharmacogenomics profile looking at 60 SNPs across 20 different genes that provides dosage guidelines on close to 100 drugs. Some of the classes into which these drugs fall are antidepressants, antipsychotics, pain medications, anti-inflammatories, reflux or stomach medications, and blood thinners. We all know so many people who are taking drugs of this nature, or possibly even multiple drugs across these different categories. Understanding how these drugs will react for that individual based on the genes that they carry will ensure that the drugs are being effective and that they're being taken at the correct dosage. Just to give a snapshot of the sample reports, we look firstly at the current patient medications in terms of what they are currently taking, and immediately red flag any issues that might be identified with the current drug list based on the genes that they carry. In this case, we give dosage guidelines to the doctor or alert the doctor to the fact that an alternative drug needs to be considered. After looking at the current patient medications, we then report on all potentially impacted medications of the individual. We're telling the healthcare practitioner the category of drugs, so cardiovascular or anti-cancer agents, the class of drugs such as anticoagulants or antiplatelets, and then we're telling the practitioner that they need to use either standard precautions, in which case there are no genetic variations that might impact the drug metabolism. They need to use with caution, which means that some variations have been identified and the practitioner possibly needs to use a little bit of discretion in terms of how that drug is prescribed. And the third category is to consider alternatives. And here we're telling the doctor that the patient should not be on this particular drug and they need to consider alternatives in order to avoid any potential toxic side effects or to ensure that the drug that they want is actually working. Hopefully this talk has given you a better understanding of who we are at DnaLife, the products that we offer, and some of the things that differentiate us in the market. In the coming lectures, you're going to be learning a lot more about the tests, the SNPs that are included in the tests, and the biochemistry and genetics that govern the purpose with which these tests can be used. I hope you are as excited about learning this information as we are in imparting it to you.